Good afternoon, everybody. Today in this week's briefing, I'm going to be more specific on the implications of our current escalation plans on staff. But before I do that, let's just have an update on PPE and on testing. So on PPE, what we do know is that we've been able to take PHE guidance, WHO guidance, absorbed that and incorporated it into our own protocol for the deployment of PPE. Behind this is always patients and staff safety. I really urge you to follow that guidance. Have a look at the intranet, it's clearly there. Please do follow it because it's important that we safeguard staff and patients that are at highest risk of cross-infection. I'd also ask you to have a look at the intranet page that shows the availability of our stock for PPE, and you'll see how tightly we're having to manage that stock. If we could have more stock, that would be great. Nationally, we're told that's more stock coming into the country, but nationally we're also told that there's some distribution problems, but hopefully we'll be over those distribution problems in the next day or so. So PPE, follow the guidance. It's really important to protect our patients and staff as best as we can. And on testing, important. What we've managed to do in recent days is to lift our testing capacity so that we can now test 530 people every day. And next week, we expect that to significantly increase. Just a few words about staff testing. At this moment, we're prioritising those staff that are self-isolating and their household members. It's really important that we focus in on this group. If you lead or manage people in that group, please ask them to undertake the test so we can get them back to work and back into a safe place as soon as possible. So let's go on to the details about staffing implications. Most of you should know now about the key escalation plans that we've got in the organisation. We have the critical care expansion, hugely important to managing those patients that are going to need that high acuity care, and we expect significant numbers to come to our doors any day now. We can't be precise at this moment in time about when that surge will happen. You will have seen on the TV that there seems to be a different prediction every day. So we're working on the assumption that there will be a significant surge any day now, and that surge will continue at a high level for quite a number of weeks. So we must maximise our critical care capacity. However, we must also provide the right facilities for non-COVID urgent and critically ill patients, such as surgical patients, such as cancer. We can't let those people down, and so we've got a balancing act to make sure that we provide enough critical care and other capacity to manage both those COVID patients that need that high acuity care and those patients, other patients that need similarly high acuity care. Those of you working community will well know how we've escalated, and we're attempting to focus in on those patients that may have normally gone to hospital to keep them at home and safe. A lot of work going on in the community, especially with our partners in the local authority and elsewhere, to make sure that's safe and secure for those patients. And our last bit of our escalation is really around our alignment with what we would call non-critical care capacity. This is to make sure that our, what we could generally call our general beds, are aligned with the likely demand that's going to come from COVID patients. At this moment, we're working through how we think those wards and departments need to be aligned to COVID patients and how we will then staff those. As the key to us managing safely and effectively in this situation is not just facilities, it's not just oxygen supply, The key is actually our staff. We must ensure that we're utilising and optimising our staff in the best possible way. The way that will ensure safety for our patients, safety for our staff, is to organise ourselves in the best possible way so that we maximise the talents and the professionalism and the competencies of our staff to those patients who most need them. And we support staff not just as individuals working in wards and departments, but as individual people who have families and friends, so that we can look after their well-being whilst they're at work as well as outside of work. So staff is key to us. I'm stating the obvious, but let me come to some points that we determined this week. A number of you, or a lot of you, have been working through how you think rotas should work into the future across this emergency period. And we've been consulting with those individuals and have determined that there are four decisions that need to be enacted from Tuesday. The first is the move for the majority of our staff, they're mostly clinical, doctors, nurses, AHPs, from the move towards a 12-hour shift. What we're hearing and what we believe is that this is likely to be the best way to deploy those talents. Now, 12-hour shifts have a lot of pros, continuity of care. They also have cons, tiredness. So we must ensure that our staff are supported to have adequate breaks during that 12-hour shift. The second decision is about ensuring that we have a continuity of service provision right across the week. We all know that at weekends we have less service normally. That cannot be the case during this emergency period. We need to maintain that level of high acuity support and care for patients right across the 7-day period. So again, the majority of staff, and many who already do this, will move to shift patterns that work across a 7-day period. So that's not working every day, 7 days, it's working a shift pattern across a 7-day period or longer, however that department wants to organise itself. The key is about maintaining that continuity across the 7 days of the week. The third point is about the ability that we have as a large organisation with multiple sites to support each other across sites. And I only expect this to be in relatively short numbers of staff who will be impacted through this decision. But it looks to us that it's going to be important for some of our staff to be seconded, to be moved to sites that they wouldn't normally work on for an interim period of time, for a defined period of time, to help manage the workload and the acuity in those other sites. Equally, it could be the case that we have staff who are asked to move at short notice for short periods of time in periods of emergency if a site has a particular crisis about a particular set of skills. So I know working across sites has caused some anxiety over recent years. I can assure you we will minimise the need to do that. It's disruptive, but it looks to us that it's going to be an important feature of the way that we manage this emergency situation. The fourth decision is about staff and their resilience. Now, some organisations across the NHS are talking about cancelling for the emergency period annual leave. We don't believe that's the right thing to do. We believe we must try everything we can to allow staff to have reasonable annual leave. It'll be in the context of making sure that we can staff those rotas. But if we can get staff to have their annual leave during this period of time, we think that's a really important feature. Our expectation is that the emergency and the impact of that emergency will last a long time, probably months. And it cannot be the case that staff don't have downtime with their families and friends to pursue what they want, to refresh them during that period of time. So 4 decisions that will impact on the majority of our staff, the majority being clinical staff, doctors, nurses and AHPs. There will be some supporting services that will have to work in that pattern as well. There's 4 decisions, 12-hour shifts, shift patterns working across 7 days of the working week, cross-site working, and ensuring staff can get as much holiday as they can. Really, really important that we manage our situation as best as we can by taking those types of decisions. Clinical leaders have said to me already that in this consultation exercise that we undertook about these decisions, they've said that they welcome that clarity from this organisation. Of course, if we think, and if you think it's not appropriate for your service, what we would expect to happen is for you to discuss that with your leaders and managers and come to a reasonable decision. I'm just going to end, as usual, by emphasising the importance of leaders to supporting staff. We need our staff to be as resilient as possible. They are our most important resource. Let's do the best we can for them. The organisation as a whole is developing things like wellbeing and support packs. But what really, really matters is the individual interaction between you as a leader and your teams. So thanks for listening to me this week. Key messages, and thank you for the great work that you're doing to support patients and to support your colleagues. Thanks.